Well, shortages have impacted nearly every facet of our life, and tonight we've got a big one to talk about. Good evening, I'm Craig O'Neill.
And I'm Marlisa Goldsmith. While COVID cases are low in Arkansas, the pandemic's impact on our supply chains is hitting pharmacies, which means it's impacting pharmacy customers too. THV 11's Sarah Horbakowitz shares how these issues are now affecting the health of Arkansans.
We're seeing shortages almost everywhere, and that includes at pharmacies where long drive-through lines await. So I brought you with me as I try to fill my own medication. But I'm not the only one having this problem. Pamela Blackburn knows the long lines at Walgreens pharmacies all too well.
For the past 2 weeks, we've been trying to get the medication.
Medication her life depends on.
This is a diuretic, a water pill, because my body builds up with so much fluid, having just the one kidney that I have.
But Pamela can't drive, relying on family to wait in hours-long drive-through lines, as she says indoor hours were unreliable.
Then she said, well, I can't feel it. We're getting ready to close for lunch. I said, I've been standing here waiting, and you're going to tell me you can't fill my prescriptions?
And unable to transfer some meds to a new pharmacy, the delay was pushing her past uncomfortable.
I was bedridden for 2 weeks. My mom said, you look so bad, we may need to take you to the emergency room.
We reached out to Walgreens about the issue, and they said their reduced or changed hours come as they've been seeing staffing challenges consistent with what many other healthcare entities have been experiencing due to the ongoing labor shortage and ongoing demand for COVID-related services. We reached out to CVS Pharmacy as well, but have not heard back. And the alternating hours at chain pharmacies are starting to put stress on local shops like Kavanaugh Pharmacy.
We have just started to increase the number of transfers. We have started to just really get a lot more people.
Putting them in a tough spot when new patients can't access their typical pharmacy.
I'm filling them and basically sending them out the door with not getting paid because their insurance hasn't filled at that store.
And as staffing challenges arise, the demand on pharmacists is increasing with them.
It has been so stressful in a pharmacy, and increased volume with prescriptions, with vaccines, with COVID tests.
After finally getting her medicine from Walgreens today, patients like Pam are left nervous for the next refill.
You have to have your medication, and I have to have my medication daily.
And back in the pharmacy line, it took just about an hour, but I was able to receive my medication. Now, it's not a clear end for these shortages, but we'll continue following up as we learn more. For now, reporting in Little Rock, Sarah Horbakowitz, THV 11 News.
If you're concerned about having to wait an hour or more to get your medicine, you have a few options to try and prevent these problems.
First, you can try to get a 90-day supply. That's 3 months of medicine at once to help reduce your trips to the drugstore. It may even be available by mail order. Your second option is the one Ann Pace just mentioned. You can contact a different pharmacy and have them transfer the prescription.